Good afternoon. I am Joel Wiggins with the GMA Government Relations team. And on behalf of the entire team at GMA, thank you to all the local government officials for taking the time to be with us today. Everyone is attempting to navigate their way through the COVID-19 public health emergency, and municipal operations are no different. Many of you have probably asked in the past weeks, how will I protect staff, citizens, and others who utilize public facilities? How do I resume municipal court proceedings? Or when should I reopen parks and other public facilities? While there is no magic bullet for these questions, we have an in-depth program scheduled for you today that will share some tips from GMA staff member Tiffany Stanley and a panel of experienced municipal officials moderated by Mayor Matt Seal of the great city of Osceola to hear how communities across the state are returning to work. All materials included in today's PowerPoint presentation and other resources will be available on the GMA website within a couple of days. If you have questions for our panelists in the last segment of our program, please utilize the Q&A feature, and Mayor Matt will get to as many questions as time permits. And now, we will hear from Tiffany Stanley, who serves as Member Services Consultant with GMA staff on ways to get you back to business.
Good afternoon. I'm Tiffany Stanley, Member Services Consultant for GMA. A couple of weeks ago, GMA created a COVID-19 return to workplace checklist for cities to use as a guide as they prepare to reopen city offices and public facilities. A lot of you had questions about what new policies or procedures you may need to adopt as you transition employees back into the workplace. Operations will look a little different, and it would not be business as usual. Each city's plan will be different as we receive daily updates on the ever-changing pandemic. Modifications may need to be made as CDC recommendations, federal and state laws, and executive orders are certain to change. CDC recommends that the specific plan that you adopt for your city be implemented and updated as necessary, and 1, be specific to your workplace, 2, identify all areas and job tasks with potential exposures to COVID-19, and 3, includes control measures to eliminate or reduce such exposures. City officials are strongly encouraged to review the reference guidance from CDC and this checklist with their city attorney. They should involve the city attorney when developing and communicating plans and obtain city attorney review of any official actions related to such plans. Cities that participate in GERMA are encouraged to contact the GERMA helpline for free employment law guidance. The information contained in this checklist should not be considered or construed as legal advice. We want to provide you with tools and resources as you develop your plan. This checklist identifies helpful return to workplace guidance for employers to consider as they develop a plan specific to their organization and community needs. It is designed to be a convenient resource document that you can refer to. The document can be found on GMA's website, and it is a PDF document that is intended for you to easily navigate and contains resources and hyperlinks that will take you directly to the corresponding source. As you navigate through the document, the blue underlined text is the hyperlink that you can click on to read the referring agency's guidance. GMA has not recreated these recommendations. The recommendations within the checklist were obtained from agencies such as CDC, EEOC, Department of Labor, just to name a few. Our goal was to compile this information into a simple format that will save you time from having to research and gather all the documentation. Please feel free to use as little or as much of the information provided. First item for review in the checklist is to review the current versions of CDC's specific guidance for critical infrastructure. Always visit the CDC website for the most up-to-date version of its interim guidance for business and employers to prepare and respond to the coronavirus disease. This interim guidance is based on what is currently known about COVID-19 and addresses how to prepare workplaces, reduce transmission among employees, maintain healthy business operations, and maintain a healthy work environment. Additionally, the CDC has specific guidance for critical infrastructure employees, such as your law enforcement, custodial staff, and others who may have been exposed to COVID-19. Secondly, review Governor Kemp's executive orders, basic public health safety orders and guidelines. Governor Kemp has issued mandates and guidance in various executive orders on measures which may and shall be taken by municipal governments to reduce the risk in workplace environments from COVID-19. The executive orders contain many specific mandates, but include no direct implementation guidance. Important requirements include, but are not limited to, screening employees for symptoms, social distancing in the workplace, and providing necessary personal protective equipment in the appropriate situations. Provide PPE is available and appropriate to the function and location of workers. This can include, but is not limited to, masks, gloves, face shields, personal hand sanitizer. We have provided you with links to PPE vendors from recommendations from Georgia Department of Economic Development, GEMA Homeland Security, and Georgia Department of Administrative Services. Establish physical distancing measures within the workplace. Some examples of these measures could include staggered shifts in lunch or work rest breaks, rotating weeks in the office and working remotely, moving workstations to increase separation distance, and implementing one-way traffic patterns throughout the workplace. We have provided a link to CDC's recommendation on social distancing. Define personal contact protocols. A few examples of CDC recommendations include directing employee traffic through the workplace, limiting the number of employees in any one area at one time, prohibiting handshake greetings, requiring social distancing in the workplace, remaining at least 6 feet apart, using video or telephone conferencing instead of in-person client meetings, and providing contactless pickup and delivery of products. We have provided a link to CDC's website, which includes these examples, as well as some additional measures that can be considered. Review EEOC guidance on screening employees, handling reports of employee illness, and CDC guidance on symptoms. EEOC, which is the Equal Employment Opportunity Commission, updated its guidance on the pandemic preparedness in the workplace and the American with Disability Acts in response to COVID-19. This update date was done on March 21st, 2020. The new information added focuses on implementing strategies in a manner that is consistent with ADA and current CDC and state local guidance for keeping your workplace safe during the COVID-19 pandemic. According to EEOC's guidance and CDC's recommendations, employers may lawfully screen employees by asking questions and testing temperature for symptoms of COVID-19. The EEOC has provided guidance for employers, including municipal employers, on ADA, the Rehabilitation Act, and other EEO laws on such practices. And they advise that employers to base such screenings on current symptoms identified by the CDC. EEOC also recommends developing a plan for handling reports of employee illness and complying with confidentiality obligations. We have provided links to CDC's symptoms of coronavirus and EEOC's webinar on employee screenings. Consider reviewing and revising contracts with vendors that enter the workplace. Based on CDC's recommendations, contracts with cleaning services, security guards, or staffing agencies should be updated to clarify expectations regarding any screening before entry into the workplace. They have an obligation to stay away if they're symptomatic or exposed to individuals with symptoms and any alterations that you may have in your service. If other companies provide your business with contract or temporary employees, please talk with them about the importance of sick employees staying home and encourage them to develop non-punitive leave policies. Review employment law resources and prepare for compliance with Families First Coronavirus Response Act, FFCRA, and CARES Act. This act requires that certain employers to provide their employees with paid sick leave and expanded family and medical leave for specified reasons related to COVID-19. These provisions will apply from April 1st, 2020 through December 31st, 2020. An employee may become sick or they may request leave due to circumstances involving coronavirus. Therefore, it is important to review these new laws and develop a plan for complying with them. Ellaby Thompson, Sapp, and Wilson, LLP, in partnership with GMA, has prepared an employment law resource document for municipalities to review with their city attorney. This document can also be found on GMA's website. The U.S. Department of Labor guidance has stated that each covered employer must post in a conspicuous place on its premises a notice of FFCRA requirements. I have provided a copy of the poster here for you, and this can be used to meet this requirement. As an employer may also satisfy this requirement by emailing or direct mailing this notice to the employees or posting this notice on an employee information internal or external website. Review eligibility requirements for employee benefits and properly handle any changes arising from reduced work schedules or layoffs. Many insurance and employee benefit plans have actively at work requirements. It is advisable to communicate with insurers and administrators, as well as with an experienced employee benefits attorney, to determine how work changes may impact employee benefits. Review the guidelines on proper cleaning of the workplace and ensure the workplace is properly cleaned and disinfected. We have provided a link to CDC's recommendations on cleaning and disinfecting your facility with everyday steps that you should take when someone is sick, and steps you should take under consideration as an employer. Develop return to workplace procedures after an employee has been exposed to or diagnosed with COVID-19. To ensure continuity of operations of essential function, CDC advises that critical infrastructure workers may be permitted to continue work following any potential exposure to COVID-19, provided they remain asymptomatic and additional precautions are implemented to protect them and the community. You can implement flexible sick leave and supportive policies and practices. Also review human resource policies to make sure that your policies and practice are consistent with public health recommendations and with any existing state and federal workplace laws. For more information on employer responsibilities, refer to the Department of Labor and the Equal Employment Opportunity Commission's website. On CDC's webpage, dedicated for businesses and workplaces, you can find this useful tool that was created as guidance to assist you in deciding when to reopen your public facilities. Questions they ask: will reopening be consistent with any applicable state and local orders? Are you ready to protect employees that are at higher risk for severe illness? Are recommended health and safety actions in place? Are you promoting healthy hygiene practices such as hand washing and employees wearing cloth face coverings? Are you intensifying cleaning and disinfection, encouraging social distancing? Is ongoing monitoring in place? If you're ready to do all of these items, then CDC makes the recommendation that you can open and monitor. Some additional resources that we have provided for you include CDC's coronavirus print resources and videos. They have some posters that are available to you that I've also included in this PowerPoint as examples. Georgia Department of Labor, COVID-19 employees frequently asked questions. OSHA has created guidance on preparing workplaces for COVID-19. The U.S. Department of Homeland Security has guidance on essential critical infrastructure. ICMA has free webinars and resources available, and they have also created a document on reopening our communities, establishing a recovery team. IPMA, which stands for International Public Management Association for Human Resources, has HR guidelines, articles, and sample policies that are available. And the American Industrial Hygiene Association, AIHA, has back to work guidelines that they have created. In order to navigate to get to our COVID-19 workplace checklist, you can easily go to GMA's website, click on the View City Focused COVID-19 Resource tab. Next, click on Key Resources, which will then take you to our Key Resource page. You would then click on Plans to Reopen, which would then take you, we have additional resources available to help guide you through your planning process. Those include a model policy requiring face coverings in city buildings, public meeting options in a COVID-19 world, testing resources. National Recreation and Parks Association offers guidance for park and recreation spaces, Governor Kemp's executive orders, the COVID-19 return to workplace checklist, and Opening Up America again from the White House. Georgia Local Government Personnel Association, GLGPA, recently conducted a poll to cities and counties inquiring about their plans for reopening. We have shared the results of the cities that responded, and it outlines their plans for taking employees' temperatures, whether they will require employees to wear masks, if they are offering telework or staggered shifts, and any policies or restrictions that they have implemented. As I mentioned earlier, as you will see from the responses, each city's plan looks very different. Communication of your plan is key to ensuring that the employees and citizens are aware of your efforts to reopen city facilities. Communicate supportive workplace policies clearly, frequently, and via multiple methods. Train workers on how implementing any new policies to reduce the spread of COVID-19 may affect existing health and safety practices. Communicate to any contractors or on-site visitors about changes that have been made to help control the spread of COVID-19. Ensure that they have the information and capability to comply with those policies. Talk with your business partners about your response efforts. Share best practices with other businesses in your communities, especially those in your supply chain, Chamber of Commerce, and associations to improve community response efforts. As you develop your city's plan, city's back to work plan, or whatever name you choose to give it, we encourage you to reference the links and guidelines that we have put in the COVID-19 Return to Workplace checklist. We hope that you find them useful and that they assist you with your preparation of your city's plan. This is your Member Services Consultant team. Feel free to reach out to your consultant anytime you need assistance. We are here to provide you with advice and assistance related to municipal governance and operations, as well as keep you updated with information about services and resources available through GMA, state and federal agencies, and professional organizations. Our goal is to provide you with the most up-to-date information as possible. I will now turn it over to our moderator, Mayor Matt Seals.
Hey everybody, Tiffany, thank you so much for that. If you guys don't know me, I am Mayor Matt Seal of the great city of Ocilla, Georgia, and I've been asked to moderate the panel discussion as part of this webinar. I think there's a couple reasons for that. One, GMA sponsors me to do a podcast called Small Town Podcast, so I'm no stranger to asking questions and then usually keep my mouth shut to listen to really good answers. But number two, and no one from the GMA staff has ever said this, this is my interpretation, it makes sense that an elected official is the one asking the questions and looking like they're actually leading the whole charge. And the folks that work every day in our cities, the staff, are the ones with the answers that we should listen to. So that's exactly what's about to happen today. We've got three great panelists, but before I introduce them, I have a few housekeeping notes. Number one, they're gonna go through a little brief synopsis of reopening operations and some things they've done in each of their respective cities. And then we'll have a chance for Q&A. So if you have a question, you can actually, there's a Q&A tab at the bottom of your screen. You can open that up and you can type in the questions. I've got my Q&A box open so I can see those, and then I'll be reading those out at the end. If you have a specific individual, a specific one of our panelists, maybe it was something they said in their overview that you wanted to follow up on, just make sure to note that because if there's a lot of questions, your question may be asked to just one of them as opposed to all three of them. So if there's somebody specific you want to ask that of, a specific thing to do in their city, just make a note of that. One more thing, I got a public service announcement. Just like that presentation and all the resources that our Tiffany just went through are available on GMA's website. There was a question about that I think got answered already. There are a ton of other resources, but our best resource is each other. So GMA has just put together a revenue tracker. We had a previous webinar about a week and a half ago on the revenue aspect of COVID-19, how that's going to affect us and what cities around the state are doing as a result of that. And so the revenue tracker relies on the finance official from each city to input some information. Obviously, the more cities, the more finance managers that are participating in that, the better the tracker will be. So we need your help. We need your support to do this. I believe there's going to be the link to that tracker that's going to be dropped in the room here, or the Q&A section. So go look at that. It won't be hyperlinked, so you'll have to copy and paste that. If you're a finance director in your city, please go to that today if you can and go ahead and do that. If you're not, please get it to your finance director if they're not on this webinar. the more participation we have, the better it is. And it's a real-time tracking so that we can kind of see what's going around the state and help each other out. So please take the time to give that input, give that feedback, and that'd be a great help to all the cities in the state of Georgia. All right, now on to the panel. I've got three guests who are going to give us some information on what's going on in their cities. And as I say their names, I'm going to ask each of them to say hello. So if you've got it on speaker view, you can see who they are. And I'm asking them to say the size by population of their city. So our first panelist is Ms. Marcia Hampton, who's the city manager in the city of Douglasville. Hey, Marcia.
Hey, Mayor Seals, how are you? Douglasville, I'm the city manager there, and Douglasville has a population of 35,000 residents.
All right, and we're going to hear from Marcia in just a bit. Our next panelist is Pam Allen. She's the Director of Court Administration in the city of Marietta. Hey, Pam.
Hi, hello, everyone. Here in the city of Marietta, I'm going to be perfectly honest with you, I do not know what our population is. But I can tell you that, dealing with municipal courts, we deal with roughly 15 to 20,000 individuals coming into the court every month. So it's a pretty good operation, pretty good size.
All right, and finally, though he's going to look like a bank robber, I promise he's the city manager of the city of Dublin, Mr. Lance Jones. Lance, say hi and tell us how big Dublin is.
Dublin is about 16,000 people. Hello, everybody. Ready for the podcast here.
All right. We're just going to go in that same order first, and each of our panelists is going to give just a kind of an overview of how things are going in their city. Obviously, we've made changes, and as we start to open back up, what procedures they're putting in place. So, Marcia, we will start with you and what's going on in Douglasville.
Well, things in Douglasville are going well. We never shut down operations. We did early on close off operations to the public. We just recently opened back up to the public on May 11th. The approach that we've taken in Douglasville is to open our operations in a manner in which we're being mindful, one, of course, of the governor's orders, what's happening on a federal level and what's happening in jurisdictions around us, but making certain that the things that we put in place, they can either be scaled back easily or we can ramp them up a good bit. So prior to opening up to the public, we did what many local governments are doing, making certain that we're sanitizing, making certain that our employees had all the personal protective gear that they needed, making certain that we had screens, that we were available and open for our employees to come back in a way in which they would be able to social distance, they would be able to be in spaces that are 6 feet apart. And then for those locations that they can't be, we're allowing some of those employees to work flex schedules where they can and working from home. For a period of time, we had the balance of our employees working from home with the exception, of course, of our first responders, public safety and public services. But most of our employees now are back in the office, and we've made the availability for them to be in a safe space as they engage with the public. We're not requiring things such as requiring them to wear masks. We're not requiring them to have temperature checks, but we are encouraging those. We've bought temporary, or I should say keyless temperature checks. So when they walk in the building, they can walk up and they can just get their temperature checked without having anybody having to touch them or having to have any employee touch that type of apparatus. We're looking at things in a similar manner as the state in a phased approach. We have opened up everything. Of course, courts will open on May 20th, with the exception of our gathering spaces. So for instance, our ball fields, our conference center, our recreation facilities, those will be opened over the next couple of months. Our first large gathering space that we opened was our golf course. We made certain to kind of follow the same method that the private courses around us were following. We've done very well. I think some folks are working from home and golfing, so we're thankful for that. Because had we not opened, we would be looking at a tough year. So the weather's been gracious for us, and we're happy for those folks working from home. So we will start to do the same type of thing with our gathering, our recreation facilities and our conference center. I have challenged our Parks and Recreation folks to come up with programming that would involve us being able to social distance, but also providing something for the citizens. Again, I think the overall goal is something we can scale back or something that we can ramp up if we would need to. We don't plan on having any festivals or activities such as those this summer. We'll revisit those at the end of the summer. We don't plan on having any organized sports. That's not something that we're doing. We're monitoring that. But we will have day camp, but our day camp will be specifically for our employees. The thought around that is because we want to make certain that we are providing something for the employees, and we know we still have some employees that are struggling to come to work because they don't have childcare. So we want to make certain that we allow that and have that as something that they can take advantage of. So we think that'll be something good that they can utilize. Our goal and our hope is that as of July 1, everything that can be open in a safe manner will be open. And again, if we have to scale that back based on any changes in their environment, we're prepared to do that. But first and foremost, we want to provide the best services that we can under these conditions to our citizens, but keeping them and our employees safe.
All right, thanks. Marsha, I've actually got a question that I normally would wait until we're all done, but you mentioned recreation facilities, and someone asked, and I don't know if you didn't mention having a pool specifically. Do you guys have pools, and what are you doing different specific to pool openings?
We do have a pool, and we're making the decision not to open the pool. And the reason we're making the decision not to open the pool is because we've had to shift some of our employees to other areas to make those areas safe for the employees and the citizens to keep up with the sanitizing and the cleaning. We've had to, and I didn't mention this earlier, but we've also had to furlough some employees because of services that we are just not going to be able to offer. So we can't even pull those folks back to what I would consider safely open and operate a pool. And we don't want to hire lifeguards to have to go through that process either. So we just think the return that we would gain from opening our pool would not be worth us going through the headache of taking that on.
Okay, thanks. And Lance, it sounds like you got one too, so you can address that when you do your comments. But we'll move on to Pam and with something specific to courts. And I did see a question in the Q&A that was about, it disappeared, so I don't have it to read now. So if you were the one that put the question in about the court there, put it back in there so I can read it off for Pam. But Pam, go ahead and just tell us your overview of how you're doing courts and what's been going on and how you're reopening things.
Okay, it has certainly been an interesting challenge that we have faced head on, as most of our courts have. Some of the things that we did in the very beginning was we separated our staff. We created separate teams and moved a team actually off-site. We felt that was necessary in the event that someone did become ill. Just that team is the team that would have to go into isolation, whereas the other team would be able to resume and keep courts running and operational. We have been full staffed since the beginning of this, although we have been separated. We are fortunate enough that we have a drive-through window at the court, so we have been doing all of our operations through the drive-through, which has reduced the foot traffic coming into our building. We've also taken into consideration, sanitation items that we need to do, making sure everything is, thoroughly clean. During this period, while the pandemic has been going on, obviously our caseload has been fluctuating somewhat, and not having court, I found very quickly that I had staff that was not going to have enough to do. So what I did is I offered, my team B, most of the individuals on team B, I offered them to other departments to see if there was something that they could do to help them out during this time, and it worked out really well. Our Public Works Department had a huge scanning project, and those employees of mine were able to help finish that scanning project for them. So we were fortunate enough to be able to keep them busy and to help another department. So as we're gearing up now to reopen court, we're scheduled to reopen on June the 1st. Some of the things that we're going to be doing, obviously we are following the Supreme Court's order. And based on that, our chief judge has issued the court's individual order. And the main thing that in the judge's order, the individual judge's order, is we have adopted the Council of Municipal Court Judges best practices and guidelines. And I encourage all courts that this is your guide and your tool to use. It's very detailed. It gives you, plenty of information on things that you should be doing. It offers great suggestions on how to deal with the social distancing aspect. And the big thing with the social distancing is, the cases don't start coming in, so we're going to be faced with backlogs. So some of the things that the best businesses practices guideline has suggested is that you reopen your courts doing staggered court sessions. We are initially going to only open up our court with 38 cases. Our courtroom normally seats 174. We usually schedule about 150 people per session, and one session is a half of a day. So we're going to obviously scale that back to 38 cases initially, and that will allow everyone to have an individual seat and be seated 6 feet apart. As individuals are coming into the building, they're going to have this health screening, temperature checks with the infrared thermometers, so there'll be no touching, just as like Douglasville suggested that they're going to be doing as well. And our employees are going to be going through the same screening. We want to show that, you know, we are trying to be as proactive as possible as our employees are healthy, especially with bringing, you know, other individuals into our environment. We want to be healthy for them as well. So once they get through the scheduling, through the screening process, then we're going to go through kind of like a little mini triage before they even get into the actual courtroom. Again, we will talk to these individuals and see if there's any, you know, serious concerns that they have. Certainly, if there's individuals that have small children with them, you know, we're not going to turn them away because the courtroom does need to be open to the public, but we will give them a couple of options. We'll certainly be more than glad to give them a continuance to another court date. We're also going to give them the option if they would like to return to their vehicle and wait until their case is called. We'll give them that option as well. We're going to try to give everybody as many options as possible since we are compelling them to come to court. We still want to work with them as closely as possible. And once we get that triage going and we kind of determine, okay, yes, this individual certainly needs to go on into the courtroom and everything is comfortable with that, we actually have a care package for each individual. And in that care package is going to be a new ink pen, a pair of gloves, and there's several forms that we generally use in court. So those forms will be in that package as well. And in all of our scheduling notices that we've sent out, we kind of have advised the individuals exactly of how court will be operating under the new guidelines. And it kind of gives them a sense of what to expect. And one of the things is we certainly encourage them to bring their own mask. However, we will give them a mask when they come in if they don't have one. Also in the packaging, everyone is going to get something that looks almost like a stadium ticket. They are going to have their individual seat assignment in the courtroom because in most courts, the individuals move around in different areas of the court, speaking with different court personnel. So we want them to feel secure that they have their own seat and that when they speak to one personnel and have to go back to the audience to be seated, they will return to that specific seat. We're hoping that will obviously make individuals feel a little bit more comfortable being in the courtroom. And in between each court session, we're going to be sanitizing. We have some equipment that does kind of like a fogging. So it will sanitize the seats and things of, to kind of keep all of the surfaces, the seats, everything sanitized. And then throughout the courtroom and, from the beginning of the building all the way through anywhere that the individuals would be, we have hand sanitizing stations available. And so we're going to be here to help them as much as possible. The main thing that I think most courts are challenged with is no two courts work alike. And this is not going to be any different. Not everything that's in the guidelines are going to suit every individual court. So I think every individual court is making their own plans. I have heard from the other courts that have opened up this week, and it sounds like they have done a phenomenal job, and they've been real pleased with the outcome on how they've gradually reopened. So we too are looking forward to reopening really soon.
And I actually had the other question I referenced before came back, and the question was, how are some courts opening up with the judicial emergency order in effect until June 12th?
Yes, that's been one of those things. I think at this point it's up to each individual court as to when they open up. The Supreme Court the Supreme Court order kind of, offered suggestions for gradual reopening of the courts. And so we decided that we were going to open the 1st of June. That gave us a little bit more time, to kind of continue monitoring the curve and to make sure that we had things in place. So it's going to be up to each individual court, as to when they feel like they reopen. And then, of course, when the Supreme Court's order expires on June the 12th, it'll be interesting then to see if another one comes out as to how we're going to be working in the future. I think we're all pretty comfortable in knowing that we're going to be doing this for a while, and this is going to be the new way that courts operate. We are doing video jail arraignments, and we're probably going to be rolling out some equipment here pretty soon, so we'll be able to do some pleas online, with the individual in their own home or the individual in their attorney's office, and do everything as much as we can by video conferencing to try to ease the burden of having to physically come to court.
All right, thanks. And moving on to our non-metropolitan Atlanta representative, part-time bandit, Lance Jones. Tell us how things are going and how you plan to open things up in Dublin.
It's going good in Dublin right now. We're doing very much like has been described. A lot of the same things Marsha's doing in Douglasville. We have done here. The big difference is we have not opened to the public yet, and it has worked very well for us so far. We have a drive-in window here at the City Hall. Most people are very used to using that now, so we're not hadn't been in a big hurry to open up. I hadn't gotten any complaints about being closed, so that was a big thing. Nobody's really calling me or the council member saying, "Hey, y'all got to get that building opened up." Anybody that's had any trouble using the drive-through been able to call in, and we'll make arrangements to meet them in the parking lot if it's something odd. So a lot of it, I'm not going to go over it all again because it's very similar to what Marsha's doing. We are planning to open City Hall Monday. We had actually planned to open tomorrow, but we had a little spike in cases in the county, and just being a little cautious there, I wanted to watch and see how that developed. So I put it off till open until Monday. I think it's just a statistical thing where we've had a lot of increased testing here, and I think that's all it was, but wanted to make sure. Watching the state numbers real close, it looks like the 7-day running average that the Constitution's been printing is continues down, so I feel pretty good about opening up. We're keeping our social distance requirements in place. All our employees are required to wear masks in any common area of the building. We're still debating a little bit on, I'd really like to require the public to, but I think from a lot I've read in places they're doing that, you almost have to have a policeman there to handle the problem when somebody pitches a fit because you won't let them in because they're not wearing a mask. So we're trying to handle that with just making sure we keep them in a very tight little area. We're going to have one way into the building, and then we have a separate door they can exit down the hall. So it'll be kind of one way in, then another way out. On the pool question, on the court question, we're waiting till till the orders have run out, and we're planning to open in June also, but a little later. And on the pool question, we have a pool that a little aquatic center that we had built and opened last year. It's under our rec authority, separate authority. County and the city are together in that authority, but in consultation with us, they have decided not to open also. And one of the big things is just trying to get all the lifeguards. It's amazing how many. I mean, I always figured you need a lifeguard for a pool, but to run even a small facility, you've got to train about 40 people for the summer for even our small thing. And they were having a lot of difficulty finding those people, especially when you tell somebody you may have a job, we'll train you, and then you might have a job for a week, and the governor might shut everybody back down again. So we were going to be operating at a pretty good loss, especially when you look at the social distancing required, which is going to be impossible anyway. You put a bunch of little kids in a pool, there's no way they're going to keep apart. It would just be a nightmare. So as I said, in consultation with us, the Rec Authority Board decided to just shut it down, not even get started this year. So I think we're probably in the same boat. Doing the same thing everybody else is doing. We're just not open yet.
All right, thanks. I got a couple questions already in the Q&A box, but if you have any questions for our panelists, please go ahead and put those in. And again, if it's specific to one of the panelists, just make sure to put that in there. We do have a specific question for Marsha. Wanted to know more information about the temperature device that Douglasville is using. And then there was another question on guidance on conducting temperature checks on citizens entering the building. So if you could just speak, number one, on the device, they were curious what you're using that's not touching, and then just any other kind of procedural things you can speak to.
Mayor, I knew someone would ask that, and I didn't have the name, but this is what I will do. I will email that out to you.
You just held it up right there.
I know, right? But the device, it looks very similar to a cell phone, and you basically walk up to it. It's like on a stand, and you walk up to it and it registers your temperature. They run about, the ones that we found online, I don't know if Pam has a similar, they're about $2,500 a piece. And I would suggest, considering that this is something that's reimbursable, that if your city can get one, you go ahead and start ordering them. We ordered our initial stock, and then that came in fairly quickly. The others, they're saying now a 6 to 8 week delay. So if you want to run out and get them, but I will send that information so everybody can have them, at least for the one I have. And Pam, I don't know if you have the same one or not.
We actually looked into that, and we have not facilitated that yet. But what we have right now is, it looks kind of like a little gun, and it's just an infrared that we get about 20 inches away from the person, and reads the forehead temperature. So.
There's actually another. Let me see here. Make sure I'm filling through my questions. A couple court questions. Somebody asked earlier, how can you do a seat assignment if family members come in with a defendant to a court? And then there was another one. I lost it, so I'll find that one and ask it when you finish this one.
Yeah, on the seat assignment with family members, that's an excellent question, and I apologize that I didn't mention that. Yeah, that's going to be a challenge. So we have a couple options. If the family member would still like to go in with them, I mean, obviously we have an open door policy. We need to keep those courtrooms open. If they still want to go in together at that point, when the person gets the seat assignment, we're going to have to vacate the row behind them, and we won't put anybody on the row in front of them. Otherwise, we would not be able to have the 6 foot distancing. Our hopes are is if the individual does come in and they want to have a family member or a guest with them, as we're cycling cases through, more seats are going to come open. Most courts, individuals don't come on time. They kind of stagger in. It's an interesting, and I know most of the courts deal with this. If their last name with a Z, they think you call the calendar that way. So they show up at 12:35 when court started at 9 a.m. But we do first come, first serve. So anybody that is frequent in our court, they know that. So you can see them lining up. But to answer the question, yes, that's going to be interesting. We'll certainly give them the option if they would like to go back to their vehicle and wait until their seat number is called. They can do that. Or we're certainly going to allow them in the courtroom, and we will deal with the challenge of trying to make sure that the social distancing is there. And we're just very hopeful that we're going to be moving fast enough that seats will come available and we can start filling in the seats up at the front, because obviously you're going to lose seatings when you start, blocking off rows because they bring individuals in.
Someone else actually asked regarding the courts. You said you were offering masks, but are you able to are you making those mandatory for people to wear in order to be in court?
Well, the judge is still looking at his individual order for our court, and I do believe that he is going to make it mandatory. Okay. And how we're going to deal with that if someone refuses, I don't know, to be honest with you. I think that's going to be one of those things that we're going to face that challenge when we come across, and hopefully we're prepared.
That's a separate enforcement issue, right?
Absolutely.
Lance, I saw you moving over there. Did you have something to add to that?
Just on I know what we've done in our court, just from being so crowded on especially on arraignment days, you get so many people in, is we have made the family members stay out, or whoever they bring with them, just stay out of the court until that case is called. Then they don't even get to sit down. They just come in and stand with them, whatever they want to do. So that's been a problem we've had regardless, and that's kind of how we've dealt with it. Just don't let them in until the case is ready.
Right. Yeah, it is certainly a challenge that we all have to deal with. We try to, and again, this is back to one system is not going to fit everybody, because courtrooms are different sizes and your caseloads are different. But we do, on normal, back pre-COVID, we were fortunate enough that we were able to find that sweet spot in figuring out exactly how many cases we could overbook, much like an airline, we overbook our seating capacity on a normal basis because we know people aren't going to show up, or they're going to pay out their case. They're going to get a continuance, and it's worked. But yes, going forward, it's going to be certainly more of a challenge, and we still want to be able to maintain that open courtroom. And from what we're understanding, that if you are able to stream your court session live, and you have a place where they possibly could watch it, or they could watch it from their phone or something of that nature, hopefully that will satisfy the open courtroom. But it is going to be a challenge that we're all going to be dealing with.
I've got about 2 minutes left here. So there was somebody asked about the fogging machine, more information on the fogging machine. I believe, Pam, you were referencing one. If you're like Marcia, you may not have the model number right off the tip of your tongue, so you may have to get that to us later. But did you want to describe it at least a little bit there? You know what kind of machine it was?
I'll tell you, we've had a couple of companies loaned these big, fancy, expensive machines that were like $80,000. That obviously was not an option for us at the moment. It looked like something from Lost in Space. It moved around the room on its own and that sort of thing. And then we had another machine temporarily that was just a machine. I tell you, it looked like a beer keg is what it looked like to me. And the fog kind of came up out of it and dispersed in the room. But what we have now is more of a mobile. It looks like a leaf blower. In fact, it's by Roby, which makes leaf blowers. And it's got an apparatus on the bottom that has the solution in it. So basically, you just walk around and you spray it up into the air so all of the particles drop down onto all of the surfaces. Relatively inexpensive. I'm not really sure how much it cost. It was something that the police department and the fire department were able to secure.
Go ahead, Lance. You want to say something to that?
Yeah, I know a source for those is your local folks that do cleaning. The big cleaning companies have come in and clean buildings. We were lucky enough to have a council member that has a cleaning service, and he just loaned us one of his for the duration. So we've used it in police car, any vehicle that people are having to switch in and out of. If you have different crews working different vehicles, different police officers in different vehicles, we've been able to use it. And in rooms, also we've been able to use it. But I'm not sure who else has those routinely, but I know that's one source you can call if you have a local cleaning service. They have them.
There's several follow-up questions, so I'll just say to the folks in the webinar, if you have a specific follow-up question for somebody, I'm sure each of our panelists would be glad if you reached out to them at their cities. They'd be glad to help you out and get you information. But there was one question at the very beginning I want to make sure I got to, and this will be for everybody, and this will be our last question. Are any of you having summer interns, or how is your intern programs being affected by this?
Our interns were supposed to start mid-May. Most of them who had accepted an intern actually declined. So based on them self-declining, we just went ahead and made the decision to just not do the program this year.
Pam, I know you were doing extra projects for your regular staff, so interns might not be to have enough going on there, but you have a program with the court system, or maybe the one in the city you're more aware of?
I'm sorry, was that for me? I was answering a question.
Internship program that you normally have that's been affected by this?
No, the court has not used an intern program in a few years, so we're not impacted by that.
Okay. And Lance, how about you?
Yeah, no interns. We have a summer youth work program that we sort of stole the idea from Savannah, and that's also dead. We just couldn't get the participation in it to do it.
All right. Well, thank you to the three panelists for your participation in this. It was great information. And I just want to say to everybody, I've been asked to close it out. There were a lot of extra questions, and this is exactly what we're supposed to do as people who work with different teams in Georgia cities around the state, is use each other's resources. We've all got very similar problems. There's just slightly different scopes and scales of things. So please reach out, share your experiences, ask questions. There's a lot of great information. We just need to share it. GMA and the staff at GMA continues to be an incredible resource. So this presentation, all of the other things our Tiffany referenced in her presentation, are available on the GMA website. the previous webinar on revenue and some of the effects that COVID-19 is going to have on municipal revenue. Those resources are available also. The tools are there. The toolbox has been built, and it is quite well filled out. It's our job to use it as city officials. So please, let me encourage you to use each other as resources and use the resources that GMA is building. That'll conclude the webinar, unless there's somebody else that's going to jump in and interrupt me. So everybody have a good day. Stay safe and stay healthy. Thanks again.